Here we're going to demonstrate how to set up a room for a new patient exam. We're going to start from the x-ray cabinet, open it, and grab the plastic coverings. We do have three types: bigger, small, and medium size plastic covering. So the medium sized plastic covering is going to be used to cover the tray, as she's going to demonstrate to you right now. She's going to grab the medium sized plastic covering and cover the delivery area with that. So she's going to cover the tray completely, the handle, and the handpiece areas. And then she will going to move on with the smaller plastic covering. She's going to cover the suction area completely, such that all the suction tips are going to be covered completely with that plastic, as you can see here. And then she's going to grab the suction tip that she's intending to use for the patient, and she's going to put it over the plastic. At this point, she's going to grab the bigger plastic and cover the entire chair with it in a way that the headrest and the handles are completely covered with the plastic. Then she's going to go to the side of the freestanding cabinet. From the third drawer, she's going to grab 5 of the plastic covering for the spray tip and 1 suction tip. From the second drawer, she's going to grab the bib. And from the first drawer, she's going to grab the prophy tip and also the cotton applicator. So from the inside of from the shelf of the cabinet, she's going to grab the dental floss and the prophy paste container. She will place all that on the tray. Then she's going to get ready to grab a piece of dental floss and also the prophy paste and place it over the tray. As you can see here, she'll grab a long enough dental floss. She'll cut it and put it on the tray, and then the prophy paste, she's going to grab it. She's going to grab a piece of it with a cotton applicator and place it over the tray. Then she will grab the handpiece. The first thing she has to do is to unlock the handpiece. It looks like she's having a hard time to do it with the plastic over it, so she's going to take it out, unlock the handpiece counterclockwise, and then put the handpiece inside of the plastic. She's going to push it to the corner and pull the plastic all the way down. She'll hold it just like that, and then the prophy tip is going to be used to place a hole inside of that plastic. As you can see on the lower side of the prophy tip, there's a key area. It's like a fissure or groove area that goes inside of the, like a little prominent area that comes out of the handpiece. So she'll place it there and lock the handpiece. At this point, the handpiece is ready. She keeps the prophy tip underneath the covering. At this point, she's getting ready to set up the suction area. She'll grab a plastic and the suction tip. This part is very easy. She puts the suction over the suction tip over the suction handpiece, and she'll cover it with plastic completely. And she'll make sure that the suction remains completely covered. So at this point, she'll grab a basic set from the lower drawer of the front of the cabinet. She'll grab a Cavitron tip from the sterilization area and bring it back to the operatory. She will take it out of the pouch. She will put it in the Cavitron handpiece, and then she'll cover it with the plastic completely, and she makes sure that it remains completely covered. At this point, she's going to return the floss container and also prophy paste container back on the shelf in the designated area. After this, she will grab the basic set. She will poke a hole at the bottom of the basic set with the spray tip and she will slide the spray tip out of the pouch, and then she will place the pouch facing up on the tray. She's trying to demonstrate to you how to put the tip over the spray handpiece, and then after placing it, she will cover the entire thing with the plastic covering. At this point, the only thing missing on the tray are the glasses and also the bib chain or the bib holder. She places it over the tray, and at this point, the tray is completely ready. The next step would be to prep the intraoral camera. You grab it from the first drawer on the front side of the cabinet and cover it with the covering that you grab from the second drawer on the front side of the cabinet. You grab the two upper pieces of the plastic covering and place the camera underneath those two pieces with the writing of the camera facing up. Then you put it on the handle of the drawer. She's grabbing the bite wing tab from the sterilization area. She's taking it out of the pouch. She grabs the sensor, and then from the first drawer on the side of the freestanding cabinet, she grabs a covering for the sensor. She covers the sensor with that plastic with ultimate care. You have to understand these sensors are very expensive. They're about $10,000, so never ever pull the sensor from the cord. Then she places the sensor inside of the bite wing tab. Then from the cabinet over the computer, she grabs a bigger plastic and she places the whole thing inside of the bigger plastic covering. At this point, this is ready to be used. She places it over the suction area. So now she grabs the x-ray tube from the x-ray cabinet along with a small plastic covering. As you remember, we said we have 3 types of plastic covering inside of the x-ray cabinet: small, medium, and large. She grabbed the small one. She will be covering the tube, and then she will tie a knot in a way that the tube can be easily moved up and down. So you want it to be relatively loose. At this point, we have everything ready: the tray, the chair, the x-ray and the suction area, the x-ray sensor and the suction area, the Cavitron tip, the camera. Make sure that the Cavitron tip stays completely inside of the plastic with no areas exposed. Remember, it's very important for everyone to follow these steps very carefully, as we take pride in having the cleanest in our office, and we try our best for our patients to feel safe, and not only that, for our staff to be confident that they're working in a clean environment. And that concludes this training video, and thank you for your attention.